Good afternoon, everybody, and thanks so much for joining this session. It's really great to have you, and I think it's been a fabulous day so far. I've managed to sit in on some of the other sessions, and there's been some really great discussion. So I'm very excited to have this panel coming together. I think we've got a wealth of experience and knowledge that's going to be shared with you, and then a good section, hopefully, for some engaging discussion through the Q&A. We've got 4 panelists, and as always, we want to make this as interactive as possible. So please do, as you have with the other sessions, add your questions in the Q&A box. If you have a question that's specific for one of the panelists, please make sure you tell me that, and then I'll try and direct it to the right person. So we're going to hear from each of our panelists, and then we're going to have the Q&A session all together at the end. So my name's Georgie Humphreys. I sit at a funder, Wellcome Trust here in the UK. And I'm within a team called Open Research, which is, as you can imagine, all about making science more open and accessible. And we spend a lot of time thinking about data sharing and how best to support it. I think in this session on international data sharing, I can't possibly not mention COVID and the year that we've all just been through. It has been a staggering year for lots of reasons, but there are a number of really exceptional positive things to take from it. Despite the disruption and sad cases of issues around COVID, we've seen some fantastic sharing at pace, some fantastic collaborations, and I hope that this won't be deja vu all over again, as we found with Zika and Ebola and other public health emergencies, where there was a real shift in sharing and openness, but that didn't remain in the long term after maybe the emergencies were over. It was great also to hear Ottoline this morning talking about equity in data sharing and data access, and I think that's going to come out, I hope, from our panelists' different views of trying to get that right. That's not always easy. So I just wanted to take you through a couple of examples where I think that things have gone really well this year, and some of the champions as I see them with respect to international data sharing. Not least, of course, starting on the 10th of January, we had that first genome sequence shared by a consortium led by Professor Zhang in China and Eddie Holmes from Sydney, who loaded that sequence, which almost overnight was, of course, used by hundreds of other researchers around the world, not least vaccine developers who, of course, have worked at such pace to now come to the fruits of those labours very recently. I think we've seen from the HDR UK COVID portal exercise scoping the existence of what repositories are out there now, more than 100 COVID data sharing portals and repositories available, which is fantastic in terms of all the effort that's gone in, but presents a challenge in terms of bringing data together, whether there's standards between these and how we can all work together to do the analyses, which hopefully will follow. We've seen a massive increase in the use of preprints and open peer review systems, thousands and thousands of COVID-related content preprints appearing every week. And that, again, has presented some real challenges, not least, of course, checking quality. There's been a heterogeneity, of course, in quality, and there's not enough reviewer time to kind of go through all of those preprints at such pace. From a funder point of view, I can say that we've put a lot of effort into cross-funder groups, international groups like GloPID-R, I think is worth mentioning, the preparedness of epidemics, which has spent a lot of time on data sharing and trying to align on principles that we, as all different funders, can agree on, which has been valuable. And then lastly, I thought this has already been mentioned today, I know, but of course it's such an important case that in the UK we've had the recovery trial findings. And I do think it's staggering and worth mentioning that it is unprecedented, and I know that that word's been used a lot this year, that you can have trial results reported in a morning, like they were for the dexamethasone arm, and by that evening, patient care had changed in the UK. So treatment guidelines being changed within the same day of trial results being shared. That is just staggering. And hopefully, as I say, we can maintain some of that even long into the future. And I don't want to underestimate that there are still challenges remaining. Of course, there are, notably in credit and recognition for champions of sharing, particularly in the academic sector and the publishing norms. I think community use of agreed standards in metadata, fair repositories, and being sure what that means, the same to everybody. And of course, from a funder point of view, I think sustaining support for infrastructure is also clearly an area that needs more thought and long-term commitment. So on that, I will hand to our first panelist, which is my good friend Pegyong Chia, who's an associate professor at the University of Oxford, and she's based in Mahidol Oxford Research Unit in Thailand. So I will hand to Pegyong. The floor is yours. Thank you.
Thank you, Georgina. Hi, I'm speaking to you from Bangkok, where it is 10 p.m. now. So my name is Pegyong Chia from the Mahidol Oxford Tropical Medicine Research Unit. We are a research hub based of the Oxford University. So I am the coordinator of the MORU Data Access Committee. I'm an ethicist, and I also conduct research on data sharing. MORU here conducts large clinical trials in Southeast Asia, and Africa. We typically have large data sets involving multi-country studies, and all our data are collected from low resource settings. So we work on studies, diseases like malaria and now COVID. So one example is a data set we collected of severe malaria in children, of more than 5,000 children. It was an RCT, a randomized controlled trial of artesunate versus quinine, and the study changed malaria treatment guidelines. So this study will never repeat it. We know because we already know the answer, and it will take too long to recruit this many patients if you were to redo it. So we think that this data set, along with others that we have, are really, really important, and they are to be used and reused. So Georgie asked me to speak on the things that worked for us in terms of data sharing. The first thing is that we have a data sharing policy that was developed after careful internal consultations with all levels of our staff and researchers. And in addition to that, we also did a lot of consultation with our public advisory group and community advisory group. At MORU, we have a community engagement program that started many years ago. Our community advisory board is more than 10 years old, and we can trust them to tell us what they think honestly. We have also done some empirical studies involving interviews with community members and research participants. So we've gathered this information. We know what researchers are concerned about. We know what communities are concerned about. And as I mentioned, we work with vulnerable communities. We asked them about consent. We found that most people, although they agreed to have their data used broadly, they didn't really understand what data sharing meant. So we know this, or we get their consent, but we worry that they don't fully understand that who it will go to and what it will be used for. So based on these, we agreed that a managed access system is much better than instead of an open access system. So we would have a review process. People who would like to use our data set will apply for the data set. We will look at who is applying, what the data will be used for, and how will the primary investigators be credited. Once approved, we have the agreement with the data requester, and in the agreement, we will say things like, you agree only to use data for the objectives you have stated. You will not try and identify patients. You will not share the data set with other parties, and you will acknowledge where the data set is from. So this, the first thing was consultations, and this consultation informed our data sharing policy. So I'll come to the second point. The second point is actually the data sharing policy. After the series of consultation, we developed our own data sharing policy. And I want to emphasize that this is a really, really important process and document internally as well as externally. Why is it important? It is important for internal communications and consistency. It ensures that everybody understands what the policy is, because there's a consultation. It ensures that data that is generated is of high quality and shareable and collected at the outset with data sharing in mind. This also maximizes the utility of our own data sets for both primary and secondary users. It serves as internal self-motivation to share data. And of course, it also allows us to comply with funders, journals, and other regulations. It also puts us in a strong position when applying for funding, submitting papers, and applying data sets for secondary use. The third thing is that within the data sharing policy, we've established a data access committee. It is an institutional committee, which is responsible for reviewing and assessing data requests and subsequently approving or disapproving them. So Moro, our data access committee has internal members and external members. There are senior members within the organization and representatives from our various hubs. For example, in the various regional hubs, and for example, we have an office in the Congo, and we have a representative there. We have data managers on the committee, and I'm the ethicist on the committee. I'm also the coordinator of the committee. Having a deck that has deep understanding of the context and understanding of the communities is really important. Okay, the fourth thing, I'm not sure whether I'm running out of time or not. So the fourth thing, okay, I think I'm okay. So the fourth thing is that we have a good data management team. And when I started in Bangkok, I started as the head of clinical trials, which includes data management. So it was about 10 years ago that we set up a data management team. Without a good data management team, you can't do data sharing. So the team was well-resourced, very capable, and they are involved from the beginning of the study until the end. So they train in the whole data life cycle, designing data management plans, provide input in protocol design, designing case report forms, up to collection, curation, storage, and then sharing. Now, I must say that since the establishment of our data sharing policy, we've had quite a lot of requests. Maybe a lot is relative here. So, and we have honored most of them, and those that we haven't given access to the data set, they are under a review or under data preparation. Right, that's all from me. Thank you very much.
Thanks so much, Pegyong. That was great, and great to have some international representation at this meeting too. So value that. Okay, we're going to switch straight to Gary now. We've got Gary Saunders, who's human data. Oh, there we go. Human data coordinator at Elixir. The floor is yours, Gary. Thanks.
Excellent. Thanks so much. And good afternoon to everyone. And thank you for the invitation. And I'm really looking forward to this session because international open research and data sharing is a key goal of Elixir. So I'm the human data coordinator at Elixir. For those that don't know, that's an e-infrastructure, a European e-infrastructure for bioinformatics. And in these next few minutes, I've tried to focus on the big questions that were posed to the panel. And I'll try and give a concise one-slide answer for each, focusing on sustainability, which is a key goal for Elixir. And I see that that's one of the questions that's come through already. So the first question that was asked to us, next slide, please. The first question that was asked to us was, who are the winners of data sharing? So the perspective that Elixir tries to keep in mind is that it's citizens that will be the long-term winners in the goals of international access to sensitive human data. And when we think about international access to sensitive human data, the political will is there. So in 2018, many EU and EEA member states signed a declaration to access at least 1 million human genome sequences by 2022. And for this declaration, there are now 23 signatory countries and 5 observers. And what these 28 countries have formed together is something called the 1+ Million Genomes Initiative. And for this 1+ Million Genomes Initiative, they published a roadmap of how they can get to meet the aims of the declaration to share international access to 1 million human genomes by 2022. Now, Elixir the European e-infrastructure for bioinformatics, we've been involved in the implementation of this roadmap of the 1+ million genomes initiative. So we were awarded a project called Beyond 1 Million Genomes. So this B1MG project will resource the implementation of the 1+ million genomes roadmap to access 1 million genomes by 2022. Now, a major driving force of the B1MG project is to demonstrate the impact and the socio-economic benefit to accessing sensitive human data at this scale, and accessing sensitive human data internationally, overcoming the many huge challenges that we know that we have. So data volumes, ELSI requirements, technical infrastructure. Now, the objective of the B1MG project, a key goal of it, is to demonstrate these socio-economic benefits to leaders and decision makers in order to drive forward the framework for accessing this volume of data internationally. The second thing that I was asked to comment on was what's working well right now for Elixir. And I've put at the top of this slide the statement, collaborate on standards and compete on implementation. Next slide, please. Sorry, I forgot to ask. Now at the top of this slide, yes, we can see collaborate on standards and compete on implementation. So Elixir is fully committed to open research, open data, open code. And this is a key driver of our coordinated infrastructure for sensitive human data. So we're dealing with many, many stakeholders, and to converge on technical implementation is difficult for many reasons. It may very well be that we can find small pockets of collaboration on implementation, but on a pan-European scale, such convergence is incredibly difficult. Therefore, the focus is on standards that underpin the technical implementations. Elixir itself is not a standard-setting agency, so we formed a strategic partnership with the standard-setting organization, the Global Alliance for Genomics and Health, the GA4GH. And that allows the requirements for new standards and products that are delivered by GA4GH to make sure that they meet the needs of Elixir, so that they're ready to be implemented across Elixir as they're approved. And this figure provides examples. So starting on the left-hand side there, data discovery is a huge challenge to many use cases, for example, rare diseases. And Elixir has a strong focus on a standard from GA4GH called the Beacon, and has supported the development of a reference implementation. So this reference implementation can be used directly by the Elixir nodes, or much more commonly, can be used to drive innovation. And this is not limited to only Elixir partners. As I say, we're committed to open research, and therefore the examples of our reference implementation are open to, say, industry or international collaborations. And it's in this way that we're able to coordinate an interoperable framework that is underpinned by these standards. And so this is working well for Elixir to connect via standards-based federation, which drives interoperability, but also innovation at the implementation level. So then the last question I was asked to comment on was, next slide, please. Oh, yes, I see it now. What comes next? And I think there are two key aspects for Elixir: federated data analysis and implementations of the infrastructure that are sustained nationally, funded on national roadmaps and sustained nationally. So on the previous slide, I had part of the diagram for federated analysis. So this is the technical part that is coming next for the federated network of analysis to sensitive data pan-Europe and across the globe. And this really is the critical step for reaching the potential of sensitive human data and how it will impact the life of citizens. However, we're not quite there yet. In the B1MG project that I referenced, we're building proof of concepts for certain use cases, including rare diseases, cancer, common complex diseases, and infectious disease, but they're in development. And we're only starting now to think about how we can federate data analysis across the member states. In addition to the technical challenge is the overarching challenge of sustainability and coordination of access to sensitive human data. So as I said at the start, Elixir is coordinating the implementation of the 1+ million genome roadmap via the B1MG project. And one of the key deliverables of this B1MG project is to build a maturity model for providing access to sensitive data on a national scale. So this maturity model will describe the socio-economic benefits to invest in infrastructure to provide international access to sensitive human data. And therefore, this is the key to build business cases, shared business cases that are coordinated pan-Europe to resource parts of this infrastructure to access sensitive human data. And this will provide the sustainability of the interoperable infrastructure. So this is how we see the situation from Elixir on international access to sensitive human data. Thanks again for the invitation to this panel, and I look forward to the discussion in the session. Thank you.
That's great. Thanks so much, Gary. And we're going to move swiftly straight on to Tim Smith, who's at CERN as the head of collaboration. The floor is yours. Thanks, Tim.
Thanks very much, and thanks for inviting me. So good afternoon, everyone. Yes, I'm Tim Smith from CERN, which is the European Centre for Particle Physics, based here in Geneva, where I build open science services for CERN and for the world. So next slide, please. So what we learned, what worked well, basically we had a lot of data management experience building for ourselves massive data infrastructures spanning the world that manage hundreds of petabytes of data at hundreds of different science centers. And we also had experience pioneering the open access movement with building digital libraries. What we had to do was to marry these two to make something new, which was a research data management platform. Which demanded different skills. So in fact, what worked well was a multidisciplinary approach where we brought together the data scientist, the information scientist, the computer scientist, and the physicist to build, next please, the actual platform itself in the simplest way that everyone could search and access the information and the data. Next slide, please. So what we did was we targeted the platform by preparing different levels of data sets. Firstly, the educational simplified data sets, which were richly described, not only the tools and the techniques, but also the goals. So you could have the actual physics plots that are produced from the full data sets, like this histogram on the left, where you can see the little red peak is actually the Higgs signal that led to the Nobel Prize. And then you challenge the people accessing the platform to produce the one on the right, which is the mimic, and to see the Higgs signal themselves, which is incredibly exciting. At the same time, we prepared the full data sets, the research data sets, which required millions of lines of code to accompany it, with all the visualization libraries, the analysis libraries and everything else, packaging them up into virtual machines that then could be downloaded and used anywhere. Next slide, please. So who was this for? Well, if you believe the headlines, it was for everyone. So for scientists could now discover the dark matter that we've failed to discover on their sofas. Well, reality is a little more difficult because these are massive data sets and esoteric science, but nonetheless, it has proved useful to various different audiences. Next, please. So the first is within our own field. Traditionally, experimentalists would test theories, but more and more now with this open data, theorists come up with weird and wonderful new ideas and can test themselves without relying on the experimentalists to do it. Next, please. Then within our own field, again, the different engineers and computer scientists and physicists can develop new techniques from combining data sets across experiments, techniques that would help the current analyses, but also preparing for the next wave of data taking, which will be at orders of magnitude more. So we're using the latest techniques and finding out how they work on the current data sets. Next, please. Then outside our own community, there are computer scientists and engineers from vastly different walks of life that are rising to our challenges of using the data to tune certain parts of the techniques of track finding or pattern recognition. And these challenges are incredibly popular using the open data as well. And then finally, next please, can't underestimate the power for the next generation. Teachers having access to the real cutting edge research data in the classrooms, university lecturers having them to teach in their tutorial classes is incredibly powerful, and we get huge amount of feedback on this aspect of inspiring the next generations. Next, please. So what are we on to now? Well, what we learned from building that was open is not enough. Just putting out the software, massive sets of software, putting out all of the data, making it usable was not enough. You actually had to describe it differently, run it differently, prepare it for being run by other people. So describing your analysis when you finished it 2 years afterwards is not enough. So more and more techniques of describing a complex analysis in terms of the steps it takes, and then which are the input data, which are the output data, and in a workflow language that can be instantiated by an automated process, leads us to be able to now build what we've called the ReANA, the reusable analysis framework, where we can take a data set, any software, the environment described, the workflow for an analysis, instantiate it on the cloud or locally, and generate the physics results. So this is inspiring new techniques for the way we actually do the current analyses, knowing that they will then be usable again by other physicists and by other sciences and generations to come, because it's described in a reusable manner. So finally, next please. Another type of reusability is to take the entire stack that we've done for ourselves and instantiate it again for everyone else. So what we've created here is the open science platform Zenodo, where we make available the same tools and techniques and capabilities for everyone else, for any science to upload, and encourage the sharing of data sets between different sciences. But moreover, we make it available to everyone that actually doesn't have access to such platforms in their local communities, in their nations or whatever. So through this, we're using this as an outreach to, if you like, evangelize the ideas of evidence-based decision-making and evidence chains, to pass the message, to help reinforce, with journalists, with the public, like we were discussing earlier, the fact that when you see an article, it should be natural that the journalist has put a link to the science they're describing. So the sensational, headline that catches your attention, you can click, get to the science, and the science will then click and get to the data set, and you can yourself look at the data, understand what the meaning of it is, what has been measured. Or equally, if you're another scientist, you can see a technique like the black hole imaging here and think, what a fantastic technique. Click once, have it described, click again, get to the actual software used openly and reuse it in your own science. So this idea of sharing and collaboration is through a platform such as Zenodo. So finally, with the last click, as part of the pandemic, we made this platform available, a part of it, with the resources and the help to actually empower people that haven't shared before to upload, to help them to describe it, to help them to make it findable, such that then different disciplines could get together and try out this open science with the necessity of the pandemic behind it. So this means scientific disciplines like the segmentation data, the diffraction images, but also crowdsourced data such as the changing pattern of education as done within the home as well as within the classroom, or the last interesting one, which is the changing the crowdsourced observations of different traffic patterns in the air. So once all of these are then combined, people can do studies in ways unimaginable before, because they suddenly have access to different diverse data sets. Thank you.
Brilliant. Thanks so much, Tim. And I think you win the prize for the most impressive backdrop. That's definitely the best picture we've seen. Okay, we're going to, last but definitely not least, move to Rachel Plachinsky, who's on the HDR UK Public Advisory Board. So Rachel, over to you, and then we'll have questions afterwards.
Brilliant. Thanks everybody, and thank you for inviting me to join this panel. It's really interesting to hear everyone. So yes, I'm on the Public Advisory Board, and I'm involved in several research projects in the UK, primarily to do with maternity, but I've also been part of Cochrane and a Cochrane consumer for the last 8 years, and last year I joined the Consumer Network Executive, which advocates for consumers across the organisation, and was also I've also become a member of the Cochrane Council, and I feel very fortunate to have the opportunity to be involved in Cochrane and to talk about how it involves patients and the public. Cochrane has done this since it started in 1993. So in many ways, we are very well, our viewpoints, our perspectives, our experiences are very well embedded in the organisation, but yet there are still things that I can share with you about, things that we found that work on an international basis, but also some that we really need to address to truly get to, I would say, the basis of the human condition, rather than one that's based on entirely on cultural issues or ethnicity. So next slide, please. So yes, as of last week, Cochrane had 1,790 consumers signed up from 79 countries across the world. We are, the majority of those consumers are concentrated in Europe, North America and Australia, I have to say, but we do have, as you can see, representation across the globe. In fact, we probably have even more people contributing to our work. We for some reason, we have great difficulty getting consumers to, even though they're signed up to our network, to respond to our surveys. So, you know, finding out their exact backgrounds and so on is quite tricky. And we also know that some people are involved purely with a particular topic group and never bother to join the consumer network. But our best estimate is that we have up to 500 people at any period involved in contributing, primarily commenting on protocols or first drafts of a systemic review. And some consumers do progress to join author teams or become lead authors themselves. My own mentor is a lead author from a consumer background. So next slide, please. So yes, this is what's worked for us. The founders of Cochrane were very keen to have consumers involved, and so we've just been there since day one in various forms. And the network executive was set up 2 years later in 1995. So that is a supported network. We have a consumer engagement officer. There are regular mailings to consumers to keep people informed and involved. There are opportunities for people to train. First of all, it used to be sort of face-to-face and then paper-based, and then increasingly we have videos and workshops and webinars going on that people can take part in and learn more about systematic reviews and how they can comment and help. And as I say, with things like the network executive and the chancellor part of the Cochrane Council, we have a strategic involvement as well, which I think is really important to make sure that consumer voice is embedded in an organisation. We have a statement of principles for consumer involvement that was developed in 2016. So it's based on these principles of equity, inclusion and partnership. And I have to admit, it's a wonderful thing. It was brought in because it was identified that consumer involvement was still, it's embedded on the one hand, but on the other hand, it's still patchy. There are so many different and diverse parts of Cochrane that how people were implementing their consumer involvement varied hugely. So this was the first step towards trying to create a more uniform approach and let everybody know what was expected across the organisation. The network executive developed its first strategy this year as I came on board, partly because we were so involved with so many things. People were constantly getting in touch and saying, we'd love one of your members to be on our group, our project, our network, whatever, that we didn't have time to think about how we were doing and whether we were meeting our aims. So we actually put that strategy into place to make sure we were more focused in what we did. And something I forgot to add to the slide also, that the Cochrane Colloquium gained patient included status in 2018, and that includes things like consumers being actively involved in organising and running the colloquium, that they are present in presentations, they're assisted to be part of the audience, you know, there are funding opportunities and so on available for people to join in, and also looking at live streaming to make it really easy for those people who can't make it there on the day. So yeah, we're disappointingly, with the last two colloquiums haven't been able to run. Chile was cancelled due to civil unrest, and then obviously Toronto because of COVID, but that it's very firmly, again, that expectation is now there that those major events will be patients included events. So that's really helpful for the consumers. Next slide, please. And this is why Cochrane thinks that consumers are so important. This is what we feel that wins, that consumer input is shaping research, it's answering people's questions, and as well as clinicians' questions as well, I have to say. The organisation is rooted in the experiences of both researchers and patients. And a third point, which it's I feel it's very little spoken about, and I've been trying to get this raised a bit more often. When consumer involvement is done well, it helps researchers to develop, especially junior researchers. Certainly as a consumer, I feel that when you're a junior researcher, you have to focus so hard on getting your methodology and all the other things under your belt. You really don't have the time in many ways to be dealing with the emotional aspects of healthcare, but they are important in research. And so, as I say, if we can do that consumer involvement well, we can show researchers how best to talk to consumers, to find out what's important to them, and also to cope, because people will often come to you sharing some very emotional stories, even though you just want a simple yes or no answer to some element of your project. So yeah, that's to me, that is a really important thing, that we help to shape one another as we develop things going forward. So next slide, please. So our what's next, and this is the thing I think that I wanted to talk about the most. I say I'm really proud to be part of Cochrane, and that we've done everything that we have done, but we're also still very aware that there is an awful lot more to do. We need to evaluate the statement of principles. As we were developing that strategy this year, we became very aware that we got the statement, but we hadn't actually got a mechanism in place to check that anybody was doing it. So we've managed to get that up with the central executive team, and that's moving forward. So that's something to be built in, I think. Everything needs to think about that when you're building that sort of thing in. We desperately need more consumers from low middle income countries. We need to and not just low middle income countries. We've been pushing the idea as well about, we need to know more about classifications of healthcare systems. It's not enough to say, well, we have a consumer, we have one consumer, we've got one consumer from the UK, and we've got one consumer from Australia. That's not giving a really well-rounded picture of how people interact with healthcare, the pressures influencing their use of healthcare, how they use evidence. We need to get a much fuller picture of that, and there's an awful lot of money to put in place to support that. We desperately need tech solutions for consumers around the world to help them in responding to things, in accessing documents. I think there's certainly an assumption in the UK, I'm finding amongst researchers, that everybody at least has a laptop, and everybody in the UK doesn't have a laptop. I say even here, I'm increasingly finding that a lot of people access the internet through their smartphone or possibly a tablet, and in low middle income countries, that's even more the case. A lot of people doing things purely through their phone and WhatsApp. So we need some solutions that we're not expecting people to open PDFs and Word documents all the time, and helping them to get internet access so they can join meetings, that we're giving them time as well if they don't speak English well, or it's fairly well, but it's still not as fast. You may have noticed I speak very quickly. I have to make a conscious effort in international meetings to slow down so that we can give some time to people who don't speak English that well. So that's something we need to keep coming back to all the time. And we are increasingly encountering the issue of trying to align national and international approaches to involvement in research. None of the researchers or the consumers in Cochrane are paid, but yet, because we're trying to get more consumer involvement pushed out through the geographical centres, because obviously they can support their local consumers better, but yet they have very varied resources available. They have different national standards to adhere to, and just trying to keep everybody on a similar playing field is a real struggle. So yes, that's a very rapid summary of what's happening with our international attempts to involve consumers, and I'd love to hear any of your thoughts and questions for that. Thank you.
Great, thank you so much, Rachel. That was fab. Okay, if everyone on the panel can please now turn back on your videos, and then we'll hopefully get some discussion going. This was great, and we've got already some questions coming in, so anyone else, please do add them to the Q&A box if you have some questions. I think there's a really interesting one here from, well, actually they're all anonymous, so I can't say who it's from, about the international reach of the panel, which we will tap into. Can the panelists reflect on how open science is perceived or implemented in the UK, I guess, compared to other countries? Are there countries that any of the panelists consider as exemplary in terms of their open science, and can we learn from them? So perhaps I think if we turn to Pegyong first, and then I don't know, maybe Tim or others, if you have comments on that. Let's start with Pegyong.
Well, the question is whether UK has higher open science. So I can't really answer that because I'm based in Bangkok. However, I can safely say that countries in this region, Southeast Asia, we have not really embraced it yet for many reasons. One is the data management is not fully resourced. So if you haven't got confidence in your data collection, your curation, etc., and your data management teams, it is really hard to have open science and open data. That's the first most important thing. And I think secondly, we still have to struggle about justice and fairness. I think we don't want to unfairly disadvantage researchers in low-income settings, being the data collectors. And once you have data out there, then they can be quickly analyzed by researchers in high-income settings, and they can publish quickly and in better journals. So there is a danger of exacerbating existing inequalities among low and high-income researchers. Over.
Thanks, Pegyong. Okay, Tim.
Yeah, I think the UK is definitely leading in the use of infrastructures, the policy work and things like that. But rather than looking at a national level, perhaps at the institute or the discipline level, we can see that certain disciplines are really pushing ahead on the international sharing as a goal, and developing infrastructures like some of my colleagues on the panel are developing to actually make that the goal rather than the national collection of the data. But also one aspect I think is really important, I think Pat mentioned it, was the data scientist role. So this is a new discipline, if you like, that's been created by the need of open science. And certain countries and certain disciplines are really putting a lot of emphasis on getting data scientists in each of the different labs, each of the different projects, to make sure that the right practices are put during the data collection, during the analyses, such that the sharing becomes empowered at the end of it.
Great, thank you. Gary or Rachel, do you have any comments on this question? Yeah, go for it, Gary.
From the infrastructure side, yes, the UK is seen as exemplary. And when I work with the EU and the EEA member states, one of the projects that I work in called the B1MG, one of the aspects is to try and build capacity across the other member states to try and handle this wealth of data in the healthcare system. And in that project, we've included country visits. And the first country we'll visit is the UK. So the objective is to see how the Genome England project was set up, how it's working nationally, how it's connected to the regional hubs, and then how it works internationally. So I think that's really important, yeah, that the UK maintains its status as exemplary and seen in the eyes of others as a shining light. The question also asks, where else are there good examples? And there's the collection of countries in the Nordics is a key example here. So they have, for well over 15, 20 years now, worked very well together to build coordinated infrastructure for managing healthcare data. And then not only managing that healthcare data, but providing healthcare data analysis to the rest of the world and using it for socioeconomic benefit internally, and providing very strong arguments of how you provide that socioeconomic benefit, and talking to the ministry levels. So the ministry levels who understand that level of conversation, where they need to understand that level of conversation to reinforce the investment. And then one other example I'll use here is Netherlands. So one concrete example that I've always liked from Netherlands is that anytime we talk to them about a research or infrastructure project, the minimum timeline they want to talk about for sustainability is around 15 years. And when we look at timelines of 15 years, that's not the norm across EU, EEA members when they're looking at sustainability for infrastructure. So there's many examples. Health RI would be one great project that people could look at within the Netherlands. Their sustainability plan there is fantastic. So these things are some of the answers to this question. Thanks.
Thank you, Gary. Yeah, go Rachel.
Yeah, I was just going to add, the UK is very strong. And I think it's really important that we remember that we have to, I certainly have to keep reminding myself that we are so strong, and that we have to be really careful that we don't, when we're trying to be international and again get to the bottom of the human condition, that we don't, our voices don't overwhelm, because we are so strong in this, and we have a lot of consumers, we have a lot of research in this area. We got chatting to a Cochrane member from, I think he's from Indonesia, a couple of years ago, and he worked in dentistry, and he was just really frustrated because he tried to respond to a priority setting thing on dentistry, and the European voices are kind of drowned out his experiences. So I think something like school dental nurses were prioritised in this project, and he was like, well, you know, any kind of preventative action was just some fluffy cloud way up in the sky for him. It was just trying to think out ways to stop people from, is it chewing quat or something? But that just doesn't feature because there weren't enough members. So yeah, to remember that we're strong and that we've just got to be really careful to involve lots of the people so that our voice doesn't drown out others, I think is a really important issue.
Great, thanks Rachel. Yes, of course, the power of listening well, which I'm sure we can all improve on. Certainly I speak for myself. I think there's an interesting question about open data challenges. One thing we've been thinking of as a funder, and I know other funders, is how to support data reuse, so that, you know, we talk about the sharing going on, but obviously there needs to be a reason why that sharing is going on. Wonder if anyone has any comments from the panel on the idea of these open data challenges or data reuse challenges and prizes, and whether that's a good way to go in terms of supporting those researchers that that can reuse available data.
Yeah.
Please,
So
Gary. Oh,
I think
go first, then Gary.
Oh, sorry. I think they're extremely important. We have to try on different fronts, and this is one of the fronts that actually brings immediate impact. Because on the other fronts, typically you have to notice research, you have to reuse it, you have to remember to tell the original researchers that you've used it, and they have to be interested to see what you've done with it. The challenge is much more instantaneous. You get the instant feedback that some technique from another field is working better in your own field than your own techniques, and the conversation can take a pace that doesn't normally happen through the scholarly communication. So it's we see it as very beneficial.
Yeah, completely agree. And one of the examples I can use is a project called TransBioNet in Spain. Now, this project was using a gold standard data set to call copy number variations. And it was benchmarked to say how many copy number variations one should find in that data set. And the challenge was set across 16 clinics in Spain. And the objective was to see who could get closer to the benchmark. Now, this is not a very old project. It's only a couple of years old, but what it's done is bring genomics closer to the clinic. So in these 16 settings, where people have really put an effort in to try and improve their infrastructure to call these data sets and then ultimately share the data, this is where I see the benefit. It really is these challenges which then bring new technologies to, in particular, in this example, 16 regions in Spain. But then the next challenge is to bring that to the clinic, right? So it's okay doing it, meeting the challenge, but then try and bring it to the clinic, and that's something that's being worked on in the next examples of the project.
Thank you. That's perfect, Gary, and great timing, because I think we need to wrap up. I'm sorry to those that asked questions that we haven't got to. Apologies for that. But it's been a fantastic session. Thank you so much to all the panelists for all of your contributions, to those that have asked questions. And I've got to point you, of course, to the closing plenary session, which is going to start in about 30 seconds or so. So please click through to get to there, and wish you all a very good rest of the evening. Thank you very much.
Thank you, Georgina. Thank you, everyone. Bye.
Okay, bye-bye, everyone.
Bye.